Hi everyone, my name is Dr. Michael Wald, the Blood Detective. I'm a doctor of chiropractic, a board-certified nutritionist with a master's degree in nutrition. I'm a sports nutritionist. I also provide life coaching and acupuncture to my clients, and I have an MD diploma, but not an active license to practice medicine. So today, we're going to talk about the power and the peril of probiotics. Almost anything you can think about in life has a reverse effect. Not enough water, problem. Too much water, problem. Not enough magnesium, problem. Too much, problem. So reverse effects. The same goes for probiotics. And almost no one that I meet with during my daily practice and over the course of my 33-year clinical practice has ever mentioned or known about anything negative to do with probiotics. So we're going to dispel that right now. Now, this information is for your education. It's not meant as a substitute for sound medical or health advice. And having said that, let's start out with some of the things you know about probiotics, at least you should know. They support healthy gut microbiota, balance, and digestion. We know that probiotics grow in the intestinal tract and can help reduce leaky gut and inflammation, help absorption, help the gut immunity, so many important things. Reduce inflammation, goes on and on and on. Probiotics may reduce antibiotic-associated diarrhea and gastrointestinal upset. And when you're taking an antibiotic, you want to take it an hour or more away from the probiotic. Now, the truth is, not all antibiotics will adversely interfere with or kill the probiotic. That depends on the probiotic, and that depends on the antibiotic. So that's something you want to ask your healthcare provider. You may not have to take any precautions with your probiotic and your antibiotic, or you might need to. Probiotics help support immune function and better integrity, gastrointestinal integrity in the gut. And as I've said in my podcast, between 70 and 80% of the immune system is located in the small intestine. So when you take probiotics, they don't stay in your stomach. They'll go into your small intestine. Some of them will stay there, and then some of them will travel to your large intestine, your colon, and they have beneficial effects there. And some strains of probiotics may lower inflammation and improve overall metabolic health. Probiotics can benefit vaginal and urinary tract health in women, not just women though, but also in men. It's usually about 30% of the time, if you give the right probiotic, you can eradicate the infection with no need for an antibiotic. And one of the reasons for that, when the urinary tract infection is caused by a elevated urine pH, which means the pH, which should be slightly acid in the urine, is on the alkaline end. That is a conducive environment for the overgrowth of bacteria, leading to bacterial infections, UTIs, urinary tract infections. And if you take, for example, acidophilus, that adds acidophilus to the urine, changing the environment and creating an inhospitable environment, which 30% of the time will kill the infection. Next, some probiotics will support mood and cognitive health through the gut-brain axis. And also, it's very important, probiotics, in irritable bowel syndrome and also in inflammatory bowel diseases like proctitis and Crohn's disease and ulcerative colitis. And I still to this day have clients that have visited with one or more gastroenterologists with these inflammatory bowel diseases, and they were never told to begin a probiotic. This is, as far as I'm concerned, malpractice. Miss any here? No. So what are some cautions? Some of the things about probiotics you need to be aware of, because they could be life-threatening. First, they may interfere with blood-thinning medications such as warfarin through vitamin K production. So when you take warfarin, which is also known as Coumadin, that will thin your blood. If you take probiotics that you haven't taken before, meaning on a regular basis, and you start taking this medication, warfarin or Coumadin, and you take these probiotics, they will cause vitamin K to be produced in the intestinal tract. And vitamin K is a clotting factor. So probiotics create clotting factor, vitamin K. And if you're on warfarin, that is a direct contraindication. You do not want to be taking these medications and nutrients together. No warfarin Coumadin with probiotics, ever. Risk of bacterial endocarditis in people with heart valve abnormalities, prosthetic valves, or compromised heart structures. So there have been a few studies, a few isolated cases where oral probiotics have gotten into the bloodstream and they have collected on these heart valves, causing problems. Also, there may be gastric upset in some people taking them, such as bloating, excessive gas, during the use of probiotics. Sometimes that means you're taking too much, or maybe you should take a different company or a different type of probiotic. Probiotics may exacerbate symptoms in those with SIBO or SIBO, small intestinal bacterial overgrowth, a very serious condition which we know inexpensive probiotics helps. A fecal transplant, though, is even better. If you don't know what a fecal transplant is, and I'm not shitting you, I did a fecal transplant podcast. You should watch it. Game changer. And then some probiotics may be contaminated or poorly regulated, or the numbers are just bad. So I've done probiotics podcasts where I talk about how you had to follow the types of units used that they use in measuring probiotics. Let me get one and show you right now. Don't go anywhere. So right here it's my brand of probiotics, and there's 6 billion organisms in here. That's a therapeutic amount. And we want this in units called CFUs. CFUs are about the most reliable measure. If they're in milligrams or anything else, I wouldn't trust that company. There's more to that conversation, but essentially what I just said was true. And here are just some of the tests to think about if you want to monitor whether or not your probiotics are helping you or hurting you. A comprehensive stool analysis will let you know if there's not enough probiotic, if there's overgrowth of other types of bugs, including candida, if there's malabsorption. And then a high-sensitive C-reactive protein, if you want to see if you're reducing your inflammation in your body with the probiotic, you want to see if the CRP is going down, assuming it was elevated in the first place. A coagulation profile and vitamin K status for obvious reasons. And then intestinal permeability or zonulin test, which has to do with the integrity of the intestinal milieu or lining. Do you have leaky gut or not? If you do, you take a certain amount of probiotics. Sometimes it's as easy as that, and the gut repairs. So this was an introduction to probiotics, the pros and the cons. I hope you found it useful, and I will see you at the next podcast. Thanks again.